Hi, I'm Aaron Zhang, and today I'll be presenting my project on the effectiveness of brain-computer interfaces, or BCIs, on treating medical disorders. So what is the purpose of BCIs? They're a small device, a little silicon electrode array that attaches to brain cells, and it can link to other parts of the body to control movements. And they're generally more effective than traditional treatments since they can be attached for a longer period of time, and it also uses AI to learn from mistakes and gains experience and can predict abnormal brain activity in the future. So my project will analyze each BCI with different criteria, including the performance benefits, negative side effects, reliability, and cost. So BCIs were first made in 1929 by Hans Berger. So it's not a relatively new technology, being almost a century old, but it uses electroencephalography, which is EEG, and electrocardiography to map brain cells and record brain waves and oscillations. And the four components you can see in the diagram here. First, the signal is acquired through the EEG, which rests on top of the brain, and the ECOG, which rests a little deeper into the brain. And the signal is then sent to the device and is translated into computer language, and finally outputted onto a device. It can be used for communication, control of an external object, or for movement. And one drawback to the more invasive BCIs, such as the ECOG or SSVEP and other BCIs, is that it requires deeper penetration, so they will be more accurate since they're closer to the brain cells, but they are definitely more invasive, which can be a little risky, the procedure. So some of the applications for BCIs include robotics and limb prosthesis, stroke, BCIs for stroke, seizures, and paralysis, other BCIs for excessive brain activity, and ADHD and autism, muscle injuries, ALS, rehab, and other degenerative muscle diseases, and most interestingly, in my opinion, myopia and presbyopia, so eye problems. So prosthetic BCIs can take control of both voluntary and involuntary muscles, and one trial showed 90% of patients succeeding in unlocking and using the knee prosthetic, and internal prosthetic BCIs can connect to cardiac muscle and are used to free up arteries for better oxygen flow in case of a cardiac arrest. And other BCIs, such as psychological ones, can control the brain during auditory or visual hallucinations. So this neurovision is the BCI treatment for myopia and presbyopia, developed in 1973. And this one is really important because myopia affects about 30% of the global population, and that number is expected to rise. And what the neurovision treatment does is it can both increase our color sensitivity and also our contrast sensitivity, so resolution, and it gathers several linear Gabor patches at different stages, and it combines them all into one to create a clear image. And this trial, the patients showed improvements from negative 0.5D to negative 1.5D, and they averaged an improvement of 2.2 logMAR. And one other benefit is that their eyes did not degrade or see any substantial changes for the 6-month trial period that they were in. BCIs for paralysis, seizures, and Parkinson's. So these BCIs all work pretty similarly. They trigger a response during high epileptic activity, and it sends soothing waves. And one trial with 20 patients showed 30 to 80% of patients had 30 to 80% more seizure freedom, and that is much higher than the 5% that they get from ordinary anti-seizure medication. Another thing that BCIs can do is treat patients with autism and paralysis, and the test for this was in pattern recognition. Patients with paralysis using the BCI were able to type a world record of 40 words per minute with the BCI. And the test for autism included 3 stages, including a 4th composite stage, which included aspects of communication, so speech, daily activities, and also social skills. And they showed improvements of 10 to 25% on the cumulative, and the highest difference, or the biggest difference between non-BCI and BCI users was in the communication aspect. They had about 30% higher score. So some negative aspects of BCIs. One, they're really expensive. They can cost up to tens of thousands of dollars, and that doesn't include annual maintenance costs or other additional costs. And they're really heavily reliant on the signal accuracy. Any stray brain signals can cause the device to malfunction or mislead the device to perform an unwanted action. And then furthermore, the data transfer rate between the BCI and the device is exponentially related to the accuracy, which further supports the claim that the BCI needs to be really accurate in collecting the right signals. And finally, the treatment for patients with Parkinson's and seizure epilepsy, they have been known to cause tingling sensations on the minor side effects of the spectrum, all the way to much more severe side effects, including lower body paralysis and even the inability to speak. So the conclusion is that prosthetic and neurovision BCIs are very safe, and they can be used daily, and they have really high performance benefits and are completely safe to use. But more invasive BCIs, such as the SSVEP and ECOG BCIs that treat seizures and muscle injuries, are a little too, or have too many negative side effects, which downgrades its performance. So that concludes my presentation. Thank you for watching.